Today, Go Red for Women Day. The American Heart Association organizes this day every year to spread awareness about heart disease and stroke in women. Despite the devastating impact of the pandemic, cardiovascular disease is still the leading killer among women in the U.S. And to talk more about that today, we're joined live by vascular surgeon Dr. Carla Moreira with the Warren Alpert Medical School of Brown University, also chief of vascular surgery at the VA Medical Center and vascular surgeon at Brown Surgical Associates. Doctor, thanks so much for being with us today.
Thank you. Thank you for the opportunity to talk about this really important topic. And as a woman and as a vascular surgeon, this is something that's very personal to me and, a matter of life and death for a lot of women in our communities.
So we do know statistics tell us this is the #1 killer of women. 1 in 3 women are dying from this disease. So when we see those statistics, how do we change that? What do we do?
I think one of the Go Red campaign is a great first start, but we think we need to go beyond that in terms of just not telling women of their risk factors. I think still there's a misperception that heart disease is a man's disease, but we know that it kills just as many women, more women in the United States and globally is the #1 killer of both men and women. And so it's not only spreading the information so that we empower women with information about their health so that they can, one, get treatment and get access to preventive care early on, but also making sure that we have the facilities and we have the resources available so that especially in communities of color and poorer communities where access to care, access to preventive health, and as well as treatment options are available to all women so that we can bring that statistic and that number down.
And you mentioned access to care in specific communities, minority communities as well. What is happening in those populations in our area? You're tied in with those communities specifically.
Yes, I think, especially we're living through this COVID pandemic. And a lot of some of the inequities in our healthcare system have been brought forth, and we see that. Communities of color are disproportionately being impacted by COVID, and heart disease is a chronic disease. So just like many of the things that make these communities vulnerable, and there are historical reasons for this. So in terms of long-term access to like I said, to diagnostic testing, access to high level and high functioning facilities where you can get good medical care, but also these women, especially in poor communities, tend to be responsible for their taking care of themselves, taking care of their families and extended families. So we see that the burden of disease. So these women may present later on when the disease is much more progressed, or even when they do present, they may not have all of the options that are available to treat, heart disease and to prevent complications from heart disease. So it's really a chronic problem that we're needing to address just with public health problem that we're going through now, to bring a very comprehensive and a holistic approach to understand that women's experiences through our healthcare system are different, and specifically women of color, women in poorer communities, and we need to address those things by minimizing those barriers and being present in those communities. So that's what I try to do in terms of making sure that those women in those communities know about their risk factors, know the treatment options that are available, and other things that we can do from a public health standpoint is access to good, nutritional food, access to clean water, access to, as I mentioned, preventive care are very important and key to starting to close that gap that exists in terms of our medical care and our healthcare system.
Certainly much more to be done than wearing red on one day of the year, but thank you for the work you are doing in our communities. Dr. Carla Moreira with us live before today. Thanks so much.
Thank you so much.